Okay, so for those
Mhm.
of you who don't know who I am, my name's Gemma Harvey slash Hodson, depending on which Facebook profile you look at. And I am the owner and founder and principal of the Dynamic Dog Program. And to give you a bit of background on what I do and kind of why I do what I do, I've been brought up in a house full of show dogs from the age of 6. So right from an early age, I had it drilled into me what good conformation and good movement looked like. Because good conformation and good movement were key to success. And I lived with, I say, house full of dogs, 14 dogs at one point, Cocker Spaniels, Welsh Springer, Italian Spinoni, Basset Griffon. My grandparents also had like 5 or 6 German Shepherds. So really and truly kind of thrown into it right from an early age, dragged to every single dog show known to man, even crufts, kicking and screaming. Didn't appreciate it back then, hated it back then, but it's kind of like put me in good stead to kind of what I do today. I've also got a degree in equine science, which was really, really eye-opening. And in actual fact, if it wasn't for my first horse, Poe, developing gastric ulcers over 20 years ago, I wouldn't have known what I know now about pain-related behaviour. Um, had my own dogs all through my life. Lost my absolute heart dog, Ron the Bulldog, in October last year to lymphoma. And I'm now the proud owner of a rather broken 3-year-old Staffordshire Bull Terrier. I did that thing that you tell all your clients not to do, which is to buy a broken dog. I bought the broken dog because I knew I could help him and I knew I could support him. Um, but I've also got a qualification in canine behaviour, also canine myofunction and rehabilitation. I've also, crikey, smattering of other holistic therapies as well, and hydrotherapy and physiotherapy. So I amalgamated my disciplines together because I found when I was doing behavioural work, I was automatically assessing the dog's physical condition as well. So conformation, posture, gait, basically how they use their body on day-to-day activities. And I found that when I did that and I addressed some of the physical issues that were happening with the dog, my behavior protocols and my behavior plans actually were better. And I was able to work with the dog that I had in front of me rather than just kind of working on one aspect. It was like the whole dog that we were looking at. Once the dog was fully supported and felt more comfortable, the dog was then in a better place to learn. Fast forward to today, I now teach dog trainers and behaviourists my tried and tested techniques on spotting discomfort that could be the cause of or directly contributing to problematic behaviours that owners are seeing and experiencing with their dogs. And I teach you how to spot that, all the different ways in which we ascertain a dog's comfort level, and how to relay those to the vet using a shared language so the vet can actually make a more informed decision. Dynamic Dog is now in its 4th year. It sells out every single course that we advertise, and yeah, it's so rewarding, so fulfilling, and we absolutely love being able to give this knowledge to other trainers and behaviourists so that they can help as many dogs as possible. And we are saving lives, we are changing lives, and it's incredible. So just a bit of an overview and an outline of what we're going to cover tonight. So we're going to look about, what is pain and how this manifests in the body. We're going to have a look at some pain medications, the different types there are, how they're licensed occasionally and what to expect from those. We're going to look at some of the behaviours that are associated with pain. We're not going to look at every single behaviour because that list is endless. But we're also going to look at vets and how to approach them. We're going to give you a bit of a rundown of the dynamic dog protocol, as we always do in our lives. And I'm going to show you a case example of Peanut the Foreign Rescue, one of my own clients, and exactly how dynamic dog helped that dog. And then we're going to give you lots of information about what the course entails, and you can ask loads of questions. And we're basically going to give you the spiel that we give when we're actually talking to you guys when you book a call with us. So we give you all the insider information and what you get as part of the dynamic dog course and after, basically, because it doesn't just end with the course. There's stuff. You stay with us. You get me for life, you poor suckers. And I don't know if that's a good thing or a bad thing, but you get me for life. So, okay. So, what is pain? So, to understand pain's effect on a dog, we need to know what it is. Now, according to the International Association for the Study of Pain, pain is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain is not just a physical sensation, okay? It is influenced by attitudes, beliefs, personality, social factors, and can affect emotional and mental well-being. We know when we're in pain ourselves, and if you've ever lived with long-term or chronic pain, exactly what effect that can actually have on our mental health and our mood. And dogs are no different. So pain is usually a protective mechanism that alerts your brain when your body is being harmed in some way. The nerves in that area send signals through the spinal cord to the brain, and then the brain locates the injury and then triggers the healing process. Pain signals may be triggered by a physical injury or damage to the body, for example, a sprain or damage that occurs as part of a longer term condition such as osteoarthritis. Can be chemicals produced within the body itself that can irritate the nerve endings, and this may be linked to an infection, an overuse injury like a repetitive strain, or flare up of long-term illness such as rheumatoid arthritis. And it can be damage to nerves that causes them to fire off pain signals to the brain without any physical cause, which sometimes happens in growing pain, so panesthesis, or complex regional pain syndrome. And when we have an injury or tissue damage caused by an illness, the nerves in the affected part of the body become more sensitive than normal. So pain signals are triggered more easily and warn us if there's any further threat to the painful area. Normally, as the injury heals, the nerves become less sensitive again and the pain signals lessen and then stop. When pain interferes with activities of daily living, pain-killing medications or drugs may actually help by blocking or reducing pain signals to the brain, even though they don't affect the injury or the damaged part directly. Pain isn't just a physical sensation, it can have emotive effects too, or emotional effects too, especially if the cause of the pain isn't clear or it's difficult to find effective pain relief. So pain can heighten other system responses, leaving pain pathways open on full throttle to and from the brain, which is why pain can cause heightened noise sensitivity in dogs and touch sensitivity. And emotions or mood can in turn make the pain worse or seem worse or better. If you've ever had pain for many months or years, it's not surprising that it can begin to affect your mood and even your self-confidence and self-esteem. So pain is not clear-cut, okay? The perception of pain varies from person to person. One person might have a broken bone and not even realise it, while another might feel significant pain from the same injury. That's because pain is mediated by nerve fibres within the body, and these nerve fibres have the job of sending pain signals to the brain, which happens really, really very quickly in like a split second. Once they find their way to the brain acts to make you aware of the pain. Because every person or every animal's body is different, their nerve fibres and their brain can react completely different to the same stimulus. That helps to explain why pain perception and pain tolerance can differ so much from one person or one animal to another. So what are the different types of pain? This is both a simple and actually a really complicated answer to give. There are 5 common types of pain, but some pain can fit into more than one category, which is where the complication comes in. And animals, including us, can experience more than one type of pain at the same time, depending on what's going on for them. And I'm going to try and break these down for you now. So firstly, neuropathic pain. Neuropathic pain is the result of a problem with the nerves themselves and is often caused by an injury or an operation or a specific condition. Any event that can cause an injury to the muscle or a bone has the potential to damage the nerves at the same time. Nerves can also be damaged or squeezed by tumours or scar tissue, or irritated by infection. Neuropathic pain may last for months or years and can be really difficult to treat. Some of the less obvious signs are that your pet or the dog might exhibit a painful reaction to non-painful pressure, such as touch. This is known as allodynia. Sometimes dogs actually don't like light touch. They find light touch painful and they might push up into it. Anybody ever scratch the bottom of the dog and they push up into it and they look like they're doing a bit of a funny dance? It could be that light touch is actually an uncomfortable feeling for them, so they're trying to get more pressure into that scratch in order to lessen the discomfort. The dog may feel a heightened sensitivity to pain. A dog may pull back when they are being given attention due to the extra sensitivity to touch or the sensation. Simply put, neuropathic pain occurs when the pain moves from the original source and the neural pathways become unusually sensitized. And the pain then occurs with or without stimuli. Some causes could be things like a spinal tumor, injury to the spinal cord, injury to the peripheral nerves, such as called equinus syndrome, pressure and swelling of the nerves. Phantom pain resulting in a limb amputation, perhaps, intervertebral disc herniation, bony spurs from on the vertebrae that are actually pinching some of the nerves that accentuate from the spinal cord, hypothyroidism, diabetes as well. In humans, neuropathic pain sufferers have described the feeling as follows, okay? There may be accompanying swelling. There can be pain but no tissue damage with it. There can be a lack of some sensations. The pain can come in sudden jolts and spasms. Whoever here has had like a trapped sciatic nerve will know the sudden pain and jolts and spasms that you get. And I had it not so long ago, probably about 4 weeks ago, and I felt like I'd been kicked in the butt cheek. It was really painful. And you might get the feeling of burning or stabbing or tingles or pins and needles with it as well. So if we can feel like that, and all living creatures or mammals are made up from the same things but packaged in a different bow, we should assume that it's the same for the dogs too. So somatic pain. Somatic pain is the result of an injury to part of the body such as skin, muscle or bone, joints or connective tissue. When one of these tissues is damaged through force or trauma, pain sensors send pain messages to the brain and the spinal cord. The pain feels as if it's in one place. It is constant and often aches or throbs. And somatic pain is caused generally by inflammation and repetitive trauma or excessive activity. Visceral pain. So visceral pain results when internal organs such as things like the stomach, kidney, gallbladder, urinary bladder or intestines are damaged or injured or have a specific condition. Visceral pain can be vague. It's not localized, so it can travel back and forth and is usually dull or diffuse. There may be other symptoms associated with visceral pain, such as fever, nausea, and sickness, diarrhea, basically. Visceral pain can occur when there are injuries to internal organs, damage to core muscles or the abdominal wall, spasms in those core muscles, acid indigestion or reflux, other digestive problems such as constipation, infections in the digestive and renal systems, problems in specific organs such as the pancreas or liver, and cancer that affects internal organs such as the spleen, menstrual pain, we can't rule out that as well, but also maybe allergies or intolerances to certain foods can also give us gut pain as well. So then we also have acute and chronic pain. So acute pain, this is instantaneous pain that is usually the outcome of a physical trauma, maybe a road traffic accident, a broken bone, inflammation, or a sudden infection. And this is emergency pain. And an emergency pain, that's basically pain that's trying to warn the sufferer that the body is being damaged in some way. Acute pain is, or should be, short-lasting and usually manifests in ways that can be easily described and observed. It can be extremely uncomfortable though, and may limit the dog's mobility. Acute pain normally goes away with time and treatment. Some causes of acute pain, so surgery, broken bones, cracked tooth or dental work, burns, cuts, labour. And after acute pain goes away, you should, or the dog should, be able to go on with life as usual. However, depending on how acute pain is dealt with and how the tissues heal, it may turn into chronic pain. Now, chronic pain is defined as pain lasting more than 3 months, and can go on for years and years and years, and in some cases, life. It is much more subjective and not easily described as acute pain or as noticeable as acute pain. Chronic pain, unlike acute pain, will simply not go away, and continues even after healing has occurred. Ongoing pain does not generally have any benefits to the sufferer, and in fact, it has many disadvantages. Many conditions produce chronic pain, and these include things like osteoarthritis and spinal disorders such as IVDD or a herniated disc, and cancer. Chronic pain is often called maladaptive pain because it doesn't appear to have any sort of protective purpose to it. Arthritis is a good example of maladaptive pain because it's not a disease that can be cured. In fact, it's progressive. The injury and inflammation are always present, and this leads to a constant bombardment of the brain with pain signals, and without recognition and proper management, the pain can take on a life of its own. So, a couple of studies for you on screen. Daniel Mills, FRCVS, is a veterinary researcher and behaviourist at the University of Lincoln here in the UK, and he suggests that a large portion of the behaviour problems are exacerbated or caused by physical pain, and that the resolution of that pain can mitigate or even resolve the behavioural issue. And it's certainly the case that I find in my practice, and it's certainly the case that my team find in their practice and my graduates. Almost 80% of the behaviour problems in Daniel Mills' own practice have a component of diagnosed or suspected pain. And he is passionate about raising awareness of the importance of recognising and treating pain in behaviour cases, so much so that he has collaborated with other researchers and behaviourists to publish a framework for thinking about these cases. And we cover this within Dynamic Dog, along with a case series of examples from his and others' practices. The particular study that we're looking at with Daniel Mills is actually the pain and problem behaviour in cats and dogs. If you haven't seen it, I'd go and check it out. And Mills describes a number of cases sharing a recurring theme, that the initial veterinary consult report reports the exam, physical exam, blood work, and possibly even radiographs come back as unremarkable. In other words, they can't find anything wrong with the dog. Yet a subsequent exam with a veterinarian, considering pain as a possible cause, turns up something suggestive, perhaps an awkward gait, an uneven weight distribution, suggesting that the dog is shifting weight off of one leg. Or the owner reveals under more pointed questioning that the dog has been reluctant to go for walks recently. Often an old injury that was thought to have been resolved is mentioned. Further testing finds a likely cause of pain, or sometimes not. But either way, a trial of analgesics or pain relief results in the return to normal behaviour. So this is his framework, and it divides pain-related behaviour into 4 categories. And we have unwanted behaviour directly caused by pain, pain causing secondary behavioural issues in addition to the existing ones, unwanted behaviour exacerbated by pain, and behaviours that may not be problematic to the owners or caregivers, but are actually signs of pain. So unwanted behaviour due to pain. Veterinarians are trained to recognise certain behaviours as indicative of pain being suffered, being felt, such as maybe a decrease in normal activity, licking of the affected area, very obvious gait changes such as limping, notable limping, repeated shifting of weight while standing, and most obvious of all, a flinch or a yelp when the area is touched or manipulated. Vets are less likely, however, to recognise some of the more unusual manifestations of pain, such as stargazing, compulsive disorders, which can be indicative of GI distress, pica, which may be related to musculoskeletal pain, in addition to more obvious GI link, hypersensitivity to heat and cold, increased clinginess and seeking of attention from the owner, so separation anxieties, as well as behaviours more commonly considered problematic, such as fear, anxiety, aggression, resource guarding, or destruction of household items when left alone. In fact, differences between presentations of aggression can point veterinarians to the suspicion of a pain component. In the cases described in Mills's study, dogs with pain-based aggression are often described as a Jekyll and Hyde type character, with unexpected and sudden behaviour changes. And pain-based aggression appears to occur more commonly when dogs are approached by a person, particularly when they are lying down, and that could be lying down anywhere. Floor, sofa, in their own bed, your bed. And these dogs are more likely to bite a limb than any other part of the human body. And their aggression is briefer and actually easier to interrupt. And he actually states that small dogs who snarl and snap when they anticipate being picked up are often labelled as being brats or spoilt, when they are actually suffering from undiagnosed spinal pain. And there's new research to show that actually it can be a mild luxation of where the ribs join the thoracic vertebrae. And often the behaviour will vanish or vastly reduce in frequency and intensity after the dog receives some medication for the pain. Behavioural changes caused by pain may be more subtle than outright aggression, and certainly what we find within Dynamic Dog. Dogs performing at high level in work or sports may begin to show degraded performance that doesn't have a clear cause, but resolves when pain is identified and addressed. While pain may certainly prevent a dog from reaching his full athletic potential, it can also have more psychological effects, such as making learning more difficult. You can't focus when you're in pain. Those of you that have tried to study or concentrate on something when you've got a headache, absolutely impossible. The dog may appear to be less able to absorb training. And imagine trying to listen to me do one of my Zoom lectures, for those of you that are my graduates that are watching tonight, with a splitting headache or toothache or something going on for you. Your tolerance for me would be pretty low, probably, if it wasn't already. So behaviour cases can be quite complex, and full resolution is not always reached. The owner may feel that they have hit a wall and that progress has stopped. Relapses are common and frustrating, and in some cases those final steps may be elusive because of an unrecognised pain component. Initially, picking apart which behaviours are due to pain and which are due to other triggers may be nearly impossible. However, as some unwanted behaviours are resolved through treatment of a behavioural diagnosis, others begin to appear interactable, and the relevance of pain may be revealed. In one such case, a border collie with separation anxiety was destructive when left alone, digging through the carpet and door frames and wood flooring. His anxiety appeared to improve with anxiety medication and behavioural modification. However, his digging did not. Pain in one of his hind legs was redirected to nearly compulsive digging with his front legs, and that was resolved with medication, and the digging stopped. In this case, the digging initially appeared to be part of the dog's separation anxiety, and as a result, difficulty in resolving the digging was initially assumed to indicate that the anxiety had not resolved. In fact, there was two problems present and they were completely separate. In more straightforward cases, pain does not actually cause unwanted behaviour, but instead worsens an existing behavioural problem. The relationship between pain and behaviour is actually bidirectional. Stress in the form of frustration, fear, or anxiety can cause a negative outlook that increases the perception of pain, while pain can itself increase stress. In fact, tensing from anxiety can directly exacerbate musculoskeletal pain. Who hasn't snapped at a co-worker or a spouse when dealing with a headache or some other type of pain? These cases will often present with behaviour that appears out of proportion to its cause. An animal's responses may be excessively intense, or the dog may generalise more quickly and widely than otherwise expected. For example, a noise-sensitive dog may be startled by a loud noise in one location and then rapidly generalise to avoiding a wide area, perhaps even miles, around the original source. Such overgeneralization may provide a hint that there's more going on than simply a learned association with the original startle, resulting in sound sensitivity. Impressive reduction of reactivity may be achieved in such cases with regular pain medication or other measures to reduce pain, like appropriate physiotherapy and hydrotherapy, even if the root of the anxiety remains. As we care for animals who cannot verbalize their inner states to us, it is incumbent on us to be alert to signs of pain, even when those signs do not present a problem for us. Pay attention if a formerly keen dog starts to balk. It is easy for us to normalise behaviour that is in fact not healthy, such as laboured breathing of a flat-faced dog, repetitive scratching of the neck, which might suggest syringomyelia, head shaking indicative of an ear infection, or just an unusual sitting position in a dog who cannot hold his back legs normally, perhaps secondary to obesity or maybe a spinal malformation. Veterinarians may not be alert to these multifactorial problems. Indeed, the study actually revealed that despite Daniel Mills, despite being an established veterinary behaviour expert and leading academic in his field, I mean, he's the man to go to when you want to learn, learn like a BSc in behaviour at Lincoln University. He's your man. He even still struggles to convince some vets, those in general practice, but also some specialists in relevant disciplines such as orthopedics or neurology, about the significance of pain affecting behaviour. Presented with a behavioural issue, they may reach for a behavioural solution. While a veterinarian may consider pain, given a normal physical exam and other testing, he may not pursue a trial of analgesics or even more conservative pain management measures. Addressing pain is often seen as an avenue of last resort when nothing else resolves the primary problem. And it is argued in the study that pain should be addressed first, not last. Moreover, if pain is a reasonable possibility but no cause is apparent on physical exam or testing, it is recommended a trial course of analgesics or pain meds is tried. Many documented behaviour cases have shown significant improvement or even resolution when treated with pain medication. If the first analgesic trial does not provide results, it should be appropriate to try another type of analgesic with a different mechanism of action, and I'll get onto those shortly. in case the first was not right for that dog and its particular issue. Daniel Mills actually argues that the risk of side effects can be minimized and that the benefits of using pain medication will normally outweigh the risks. But it is important that any trial is done under veterinary supervision, as over-the-counter medications for humans can actually be extremely toxic for dogs. Again, there seems to be a lot of emphasis on behaviour changes in Mills's study, but please do not forget some dogs suffer right from the start. So they can suffer right from puppyhood, because you can have hip dysplasia and things like that diagnosed as early as 2 or 3 months in a dog. Okay, so it is progressive as well. It's a malformation of a joint. But we also have dogs out there that don't have any behaviour problems at all and that have the sunniest dispositions. They are well mannered. They are the friendliest dogs, so well behaved, but they are still physically compromised and actually in quite a lot of discomfort, and they suffer in silence. So, approaching the vet. We can't just send the dog to the vet and say they need to be checked for pain. This generally does not work. There are hundreds of things that could be wrong with a dog, and you would be effectively asking the vet to find a needle in a haystack without telling them what the needle actually looks like. They need some help to get to pinpoint the area in most cases. All evidence needs to be obtained away from the veterinary clinic environment in order to get accurate data. Now, when Covey Crump came out and said at the APBC veterinary conference in 2021, I believe, that it's absolutely impossible to diagnose pain in a veterinary environment. And that's due to many contributing factors. Okay, and we'll get onto those in a sec. Owners need to be advised as well on what to expect from a veterinary consultation and actually what they can ask for. There's a lot of people out there that don't realise that, they can ask to go and see or be referred to a veterinary physiotherapist or a hydrotherapist. They can ask if a pain trial can be done. They haven't got a clue. They're waiting for the vet to tell them. And sometimes that information doesn't come, that referral doesn't come. So we need to educate the owner, empower them to ask for more, to advocate for their dog. We cannot blame the vet though. They have a hard job to do. They have to be multi-species experts, and in the UK certainly they have about a 10 to 15 minute window to assess and diagnose what's wrong with that dog, and that is not possible. They have a limited knowledge in behaviour and pain-related behaviour especially, and unless they specialise and they've gone off in orthopaedics and neurology, they have very little knowledge in conformation, posture and gait, and a lot of what they learn is done on the job. Now, the dog will almost certainly be affected by the veterinary environment, as will the owner, who is going to be worried about what the vet may find and what the vet may tell them, as well as perhaps being a little bit intimidated by all the veterinary jargon. I do assisted vet visits with my clients. That means that the owner can concentrate on kind of handling their dog, and I can listen to what the vet is saying and ask specific questions. So what can you do to get the best outcome for your client's dog? So we have found that the dynamic dog protocol is one of the best ways in which you can get results for the dog. When empowering the owner, you can explain what they should expect from the consultation with the weight of the dynamic dog report in their hand. Okay, now the dynamic dog protocol consists of a 90-minute deep dive consult, which we ask a lot of questions, and it's usually the first time in a long time that the owner feels heard and validated. We sit there and we let them talk, and we do this verbally. We don't send forms because we don't know what question we're going to ask next, because we don't know really and truly the answer to the question that we've asked before. And having that conversation makes it more personal as well. You get to know the owner a lot better and you get to understand better, and they like to be sat and listened to and heard. We then go into gathering evidence, and this is a lot of photo and video taking. And I'll get onto that when we talk about what dynamic dog actually entails. We also have a look at veterinary history and kind of go through that and highlight things that jump out to us, past injuries. Maybe there's been a recurring lameness that has been missed because the dog's had so many visits to the vet that it's been lost in amongst it all. We then go into analysing all of the photos and videos and kind of pulling together evidence and credible evidence. We then write a veterinary report and compile that evidence together. And then we do a client follow-up to explain our findings and discuss the next steps for them. We go into things like what they can ask for. We tell them that the dog is going to potentially need to be palpated. The vet is going to hopefully check that dog over from nose to tail, nose, ears, eyes, mouth, all the way down the body, finger up the bum in some cases. They're going to want to palpate those limbs, and that can look pretty rough, but they're trying to provoke a pain response. And ideally, even though we've shared a lot of video information of the dog moving, the vet should want to see the dog move for themselves outside. Okay, you can't watch a dog move on a slippery veterinary environment floor. It's just not possible. We then go into things like imaging and diagnostic imaging, such as X-rays, CT and MRI, potential referral onto a specialist or vet physio for further analysis. As a bare minimum, an analgesic trial should be requested to rule out pain. Now, that was taken from the Daniel Mills study, but I firmly believe that you can't rule out pain, not completely, not 100%. As humans, we seem to feel that we have the right to say, you don't feel that way, that's not happening, to another species. And we shouldn't be. We just don't know. We aren't them. So we should never say that the dog isn't in any pain, but we should do everything we can to minimize potential pain. So just to go over a few analgesics with you, some of the common ones and kind of how they work. So we have non-steroidal anti-inflammatory drugs, also known as NSAIDs. These are generally the first kind of go-to. So they work on something called COX, and COX is an enzyme that is responsible for the inflammatory response. But COX isn't all bad, it's actually even necessary for normal cellular processes. But non-steroidal anti-inflammatory drugs can affect COX to reduce inflammation. They do this often successfully, but occasionally there can be some negative side effects from non-steroidals due to the types of COX that they target, but I won't get into that today. But when you're dealing with non-steroidals, they can have an impact on the gut, so you should always look for kind of mucousy gut, blood in the poo, diarrhea, that kind of thing. And if there's any signs of that, you need to contact the vet straight away, because it's actually having a negative effect on the dog's gut. Some types of non-steroidal anti-inflammatory drugs include carprofen, known as Carprox, Rimadyl. These are really good for bone pain. So do you remember those different types of pain that I talked about earlier? There's different drugs that target different types of pain, okay? So yeah, carprofen, which is Carprox and Rimadyl, things like that. These are really good for bone pain. Most of you will probably heard of something called meloxicam, which is also known as Loxicam, Minoxidil, or Metacam. This is really good for treating musculoskeletal disorders and helps with long-term effects of arthritis. Aspirin is another one, very good for preventing blood clots post-operatively as well. Firocoxib is also known as Previcox, used a lot with osteoarthritis, so again, bone pain. Robenacoxib, also known as Onzior, really good for fever and pain and inflammation from both soft tissue and bone pain. We've got Gapiprant, also known as Galaprant, relatively new, probably last 10 to 15 years. Doesn't seem to appear to have an issue with the cocks that can cause gut issues. So it has less side effects to it than most. But again, depends on the dog. Every dog is an individual. You need to look out for signs of side effects. Next up, we have Cartrofen, not to be confused with Carprofen. And Cartrofen is quite an old drug. It's actually used in humans quite a lot for arthritic pain. And it's used to treat osteoarthritis in dogs. It is an anti-arthritic agent, and Cartrofen for dogs claims to halt and even reverse the side effects, reducing pain by remedying its cause. It's kind of been not phased out, but it's not used as much in the veterinary industry anymore because you have the brand spanking new and sparkly Librela. But I'm not a fan of Librela. I know many people aren't a fan of Librela. I won't get into the whys of that because I'm quite biased and I don't want to scare people. All I would say is do your research on Librela, and yeah, make your own decisions on that. So with Cartrofen, this isn't said without evidence either. So there's a study in 1996 that was done on Cartrofen that showed its ability to improve a dog's willingness to exercise, reduce joint pain. But I'm always amazed at how this drug, given the claims at being able to halt or reverse the effects of arthritis, why this drug seems to be one of the last on the list to be prescribed. You think it would be the first, the go-to, but it's not. Then we have neuropathic drugs, and these can be things such as tramadol, gabapentin, and pregabalin. Paracetamol is also used to treat a variety of different types of pain conditions in dogs and is quite a low-level drug. Pardel V, this is also known as paracetamol with cocodamol or codeine, basically. And this is useful as an alternative to non-steroidals if the dog can't tolerate an NSAID, or as an adjunct to an NSAID in chronic pain, so it can be in addition to. So when a dog is put on an analgesic trial and it's non-responsive, we should be looking at changing the drug or using a combination to see if it has any effect. Quite a lot of times we get a dog that's been put on a 2-week trial of, say, Metacam, and there's been no changes or very little changes. The owner goes back to the vet and said there's no change, and the vet turns around and said, oh, dog's not in any pain then. Let's change something. Empower the owner, say, can we try something else then? Yeah, can we try a different drug geared towards a different type of pain? Maybe the dog has more than one type of pain going on for it. Let's try something else. Also, a lot of the time, drugs can only be given on license, and that means that they can only be prescribed to 10 to 14 days at a time. Now, if a dog has been living with chronic, and that's long-term pain, 2 weeks is not nearly enough time for pain to decrease, okay? Sometimes it takes longer, okay? And we need to, maybe 6 to 8 weeks. I know Sarah Heath, veterinary behaviourist Sarah Heath, actually came out and said 6 to 8 weeks is actually a preferred length of time for a pain an analgesic trial. Okay, so on to a lovely little case study. So I want you to meet Peanut. Peanut is a crossbreed foreign rescue that I work with, and she was 4 years old when I met her just under a year ago. And the vet had already put the behaviour down, or put the behaviour down to just being behaviour, and prescribed fluoxetine, which had no effect. So some samples of behaviours that Peanut was experiencing was that he'd become increasingly scared to leave the house for a walk. He would refuse to move and start shaking, will even hide under the bed. So this is Peanut hiding under the bed. He would look up and gaze at the ceiling, so he was stargazing. He could be really sensitive around other dogs. And when the night started to draw in, he would hold his toilet in for as long as possible. So basically he was like, nope, not going outside. Nope, 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 absolutely not. So when I observed him statically, as you can see, Peanut did not look comfortable at all. So in the lateral view, we can see that he has kyphosis, which is roaching of the lumbar. He has ventral pelvis rotation, so he's rotated his pelvis underneath him, and he started to cranially tuck or position his hind limbs. And there's an element of weight shifting cranially, so he's weight shifting his weight forwards. And that hind limb position enables that weight to be shifted further forwards. It relieves pressure and force to go through the hind limbs and shifts it forward. When we looked at Peanut from behind, you could see what's known as him being cow-hocked. Now, this points to a hind end weakness, okay? And we see that the hocks here, the point of hock here and one here, they're starting to turn in, and his paws and his stifles, which are his knees, are starting to face out. And that's how you can tell that a dog is cow-hocked, okay? So Peanut, and just look at the expression in his face as well. I know this is one photo, but this photo is basically Peanut's face. That was his expression constantly. Very kind of pained, very tight, kind of furrowed brow, really ears tight to the head, tight muzzle, just not looking very comfortable at all. So Peanut's movement. I know we had somebody post in the group a few weeks back asking us to have a look at the way the dog was skipping down the stairs and ask if there was a behavioural reason why that would happen. And our resident vet, Michaela, actually jumped on and said, no, there wouldn't be a behavioural reason why a dog would do that. So this was lovely Peanut going down the stairs. So as you can see, he's skipping with his right hind. He's really reluctant to put that right hind down on the floor to help him navigate those stairs. Okay. And then when we actually started to look at him in a gait analysis setup, we could see that the kyphosis was still there. The ventral pelvis was still there. He was pacing instead of trotting. So a trot is a 2-beat gait where diagonal pairs of limbs move. Pace is where pairs of limbs on the same side move in unison, and that's not a normal gait, okay? Also, what we could see here is that because he had kyphosis, which is roaching of the lumbar and ventral pelvis rotation, he was unable to fully retract or move his hind limbs backwards out behind him, okay? So he was actually limited with how much he could use his hind limbs. So Peanut had to be mildly sedated to get him into the vet before being anaesthetised for a series of x-rays. And this was arranged as part of vet liaison between dynamic dog client and the vet. And with some dogs, we have to do this because with some dogs, it's not possible for a vet to get anywhere near them. The vet took a look at my report and all my evidence to back it up, and they agreed that there was something not right with Peanut. This was what Peanut was diagnosed with. He had osteoarthritis of his right hind, and that was the right hind that he didn't want to put down onto the ground when he was hopping down the steps. And he also had spondylosis of the lumbar and the caudal vertebrae. Now, spondylosis is where you get bony bridges forming on the underside or the ventral side between vertebrae, and it effectively fuses the spine. And they say it's only painful when it's forming, but you know, it's got to hurt. If you're trying to flex and there's a resistance there because something's stopping it, that's also got to hurt as well. And it bloody hurts when they break, and they can break, those little bony bridges. But you could see he had little bone spurs forming on the undersides of his vertebrae that started to fuse his spine together, but then also on the vertebrae on the caudal vertebrae underneath on his tail as well, bless him. So treatment. Peanut was placed on gabapentin. He was also placed on decent, really decent joint supplements, so Riaflex, and it was teamed with Boswellia. Fluoxetine was removed, and he's going to be having ongoing support with a physio and or hydrotherapy. Now, physio and hydrotherapy are a drug-free pain relieving modality. Those of you who have not looked into hydrotherapy before, I implore you to do it, because the therapeutic properties of water are second to none. It can be hugely beneficial to a dog that's suffering physically. He also had to have a CT and MRI to find out the extent of the spondylosis, because it was thought that he might also have nerve impingement there as well. So those bony growths, those bony bridges that were forming, were actually potentially starting to pinch some of the nerves that come out of the spinal cord and go down into his hind limbs. And if need be, he was going to have surgery. I'm pleased to say that because Peanut is being supported by pain meds and ongoing treatments, that his behaviour is improving, and he is actually starting to have some sort of relief. However, spondylosis and arthritis are progressive conditions, and that means that he's going to need ongoing support for the rest of his life. So, Dynamic Dog, what's it all about? What does the course entail? What does it teach? And how does it change things for dogs? Strap yourselves in, guys. We're giving you everything here. Okay, so Dynamic Dog is a 6-month structured course that is doubly accredited with UK Rural Skills and CPD standards, and it holds 80 CPD points. The course is split over 4 modules, 2 theory-based modules and 2 practical-based modules. Each of the first 3 modules have 3 assignments in that have 2 parts to them. And every assignment has a deadline that needs to be met. We are quite strict because we need to keep you moving through the course to make sure you keep up to speed with everything. We take up to 48 hours or 2 working days to give feedback on assignments, so we are actually very, very quick with this. And feedback for theory-based assignments is given in writing, but feedback for the practical assignments is actually given via a one-to-one Zoom with yours truly, myself. And these one-to-ones are really good because it enables us to structure our teaching to the individual and the support and guidance given to the individual rather than en masse. So we're pretty set up for neurodiversity, and we welcome neurodiversity because we will adapt to help you to learn. Basically, if you tell us what you need, we'll do our very best to ensure that we can make reasonable adjustments to the course in order to help you succeed at the end of the day. The first practical module you will need 1 dog because you've got practical assignments, and it needs to be the same dog for all 3 assignments. And the last practical module that you do are actually your case studies, which are also your assessment. And then you basically can do any other dog that's not your own dog, and as long as it hasn't got a pre-existing diagnosed condition. We're not going to sugarcoat things for you. Dynamic Dog is intensive. However, there is so much support available. We assign you your own mentor, and you will meet my team in a bit. And that mentor is there for you to go to at any point during the course via email, WhatsApp, and you can book a Zoom as often as you need. And they are there to guide you in the right direction, to help you to understand assignment questions and to really get the best out of the course. Now, there's a high-tech element to this course, and I'll get onto that in a bit, in the form of photo and video taking and editing. We need things to look a certain way in order for our observations and evidence to be clear and undeniable. Okay, we also want it to look really professional when we liaise with vets. So to help you to get to grips with that, we have created a tech module to guide you through things, which gets released actually a month or so before the course starts, so that you can become proficient with the things that you need to use before you start. It also gives you a ton of spoilers, by the way. But not only do we have a tech module, but we have a tech mentor in the form of Alistair Kirk, who you will meet shortly. And who, if you've used the tech module and you're still quite, a little bit unsure, or you need a little bit of help, you can book some time with him and he will help you. Okay, he's a pretty good chap. He's a good egg, is our Alistair. And I'm really proud of my team. They are phenomenal support, and they are there to help you absolutely every step of the way. Every single one of my team members have done the course and passed it to a high standard, and that's why they work for me. That's why they work with me, should I say, because I couldn't do Dynamic Dog without them. So, course syllabus. I hear it being called the gait analysis course, and it's gait analysis is just this much of it. Yes, I do teach you gait analysis, and if it was just gait analysis, I could teach you that in 3 weeks. But gait analysis doesn't always show us what we need to know about that dog. Okay, Dynamic Dog is a complete functional assessment of the dog. We cover anatomy and physiology. Now, I call it an overview. I'm sure my students that are here tonight and my graduates would probably laugh at me and go, it's probably a little bit more than that. I'm sorry, that's the vet physio in me kind of oozing out. But I talk you through the 11 systems that make up the dog, how they work. I also throw in a bonus system, number 12, which is fascia, which is a very, very important system. And believe it or not, fascia just used to get thrown out when autopsies were done because they used to think it was a filler in the body. It's not. It's like another brain. It's incredible. We also go into conformation. So conformation is how the dog is put together in the dog factory. And we also go into different breeds and breed specifics and how different breeds look, and get to know those different breeds and how good examples of those breeds look, so that when you come across one, you can do a little bit of research and then you can compare the dog that you're working with to a good example. Okay. We look at different things within those breeds, like the history, and some of the inherent traits, not just behaviorally, but physically as well, and some of the predispositions, physical predispositions that come with a lot of those breeds. We look at the principles of movement, the good, the bad, and the ugly. So I show you what good movement looks like before going on to some not so good movement. And I give you all the veterinary terminology that surrounds all these different conformations and all these different movements. Okay. We look at a lot of specific observational techniques to ascertain a dog's comfort levels. So we look at things like gait analysis, and then we do an advanced gait analysis, and then we look at activities of daily living, not just what they are, but how they can be affected and how they can affect the dog. We also go into ambulation, so how the dog goes, gets into and out of a variety of positions. Crikey, getting on and off things, in and out of things. We look at poop stoop, wee positions, so many different things. And there's actually probably around 30 different ways in which we can analyse a dog to ascertain their comfort levels. We then go into identifying lameness. So that's true lameness, so when the dog's limping. So that's at the front end and the hind end. And I actually break it down for you. I tell you what the dog's doing with their body and why, and things to look out for, so that you can confidently identify which leg is lame and actually state that the dog is lame as well. We go into the pain and behaviour link. So I take Daniel Mills's study apart a lot more, and break it down for you. I talk about pain pathways, pain's effect on the brain, the components of pain, the different types of pain there are within the body, a bit more detailed. And we go into the different types of pain meds, delve deeper into how they work, and I talk more about COX as well. Once we understand anatomy and physiology a bit better, we look at the equipment's effect on the dog. So we look at different types of things that we put on the dog, from collars to harnesses to boots to funky jackets with furry hoods that people use. And we find out that a wide-fronted harness is actually, one wide-fronted harness is not comparable to another wide-fronted harness. There's so many different varieties and types out there that in actual fact, you need to really properly judge the dog that you have in front of you to find the right type of wide-fronted harness for them. And we look at all the kind of different things that are out there, and maybe there's some better alternatives that we can use depending on the dog we have in front of us. We also look at common canine conditions, what they are. So things like hip dysplasia, cruciate disease, spondylosis, elbow dysplasia, lumbosacral disease or lumbosacral stenosis, which is quite rife at the minute, especially in Labradors. And we look at what the condition is, how it manifests, types of pain that might be involved, how the dog might present. Now that isn't so that you can diagnose. We don't do that. We don't diagnose. That's not what dynamic dog is about. We leave that to the vet. By law, we're not allowed to diagnose. But it means that you can have a better understanding, better empathy as to what that dog is going through. You can help the owner a lot more. You could advise the owner a lot more, and you can then amend your training and behaviour protocols to better suit the dog in front of you. So if I said to you it was commonplace maybe 6, 7, 8 years ago that when working with a reactive dog, you'd ask that dog to do a default sit every time it saw its trigger rather than lunging and barking. Now, if you could see that there was a hind end issue with that dog, or the dog had already been pre-diagnosed with a hind end issue, do you think a repetitive sit or a default sit is actually going to benefit that dog? Or do you think it might compound things for that dog? It potentially is going to be compounding things for that dog because you're asking that dog to cause discomfort every time it sees its trigger. It might be changing the outward behaviour of that dog for us, but it's certainly not helping the dog. So it gives you the scope then to use something like a hand touch, a look at me, a pause up, a sprinkle some treats in the grass, a fast U-turn, anything, but you can change the way you work with that dog based on their physical abilities. We then go into bringing it all together. So we look at the dynamic dog blueprint. So you get my dynamic dog blueprint, okay, from start to finish. And we go through obviously the 90-minute consultation before going on to photo video taking of various things. We look at vet liaison, what we can say, what we can't say, what we shouldn't be saying, because we don't want to tread on their toes. We want to work collaboratively with them because we want to get results for the dog. We then go into veterinary report writing. So this is a physical veterinary report. It's very different from a behaviour report, and what that looks like, what things we should be writing, what things we can't be writing. We look at a deep dive question and answer session with a former client of mine. And we actually sit down and build a consultation together, and you get all the questions that we ask and more, okay, because we have a big giant brainstorming session which is led by my student coordinator Kerry Fosco, and you wouldn't believe the amount of questions that we ask and we think about based on potential answers that we're given to the question before. We also look at other members of the multidisciplinary team. So obviously the head of the multidisciplinary team is the vet, and we look at people like the vet physios, hydrotherapists, massage therapists, Bowen therapists, any hands-on physiotherapy kind of people. Nutritionists could be in there as well potentially. But we look at who they are, what they do, and what they can bring to the table, because it's not a one size fits all. What works for one dog doesn't necessarily work for another dog, and we need to be aware of that. And also, I'm telling you now, having done many courses with hands-on physical therapies with dogs, you get this much behaviour taught to you. And I was actually really surprised at some of the behaviour advice and teaching that was put across to me doing my courses. I've even been told not to use muzzles at one point, and I couldn't believe it. It's like, it's not safe for the dog, it's not safe for the therapist, it's just unbelievable. It was setting students up to be bitten basically, and they didn't know how to work with these dogs. And I think as trainers and behaviourists, if we can strike up relationships with these brilliant therapists, we can actually help them to understand dogs more and how they can work with them more, but also set that dog up for a more pleasurable experience and get the dog the support they need. Quite often I hear that a dog's been sent to a vet physio, that dog is reactive, and because the vet physio can't get anywhere near the dog to be hands-on with them, they say that the dog doesn't require vet physio, and then the dog loses the support they so desperately need. So we need to work collaboratively, not just with the vet, but other members of that multidisciplinary team as well. Then there's method to my madness. So I said that we teach you all the photos and videos that we need to ascertain a dog's comfort level, and you need one dog for that. The very last assignment that you do for us is a dummy run of the dynamic dog process, the dynamic dog report and evidence writing, and we get you to use all of your assignment information to put together that dynamic dog report. And that enables us to see where you are. Do we need to teach you a little bit more? And if that's the case, we absolutely do that. Or do we just need to kind of polish you and smooth off the rough edges? Once we have that dummy run report completely beautiful and massively sexy looking, we then send you off to do your case study assessments. And we ask you to do 5 case studies. They cannot be your own dog, and they cannot be pre-diagnosed with anything. Okay. And yeah, you basically go off and you do your dynamic dog process protocol with every single one, from the 90-minute consultation to the data gathering, the assessment, the report writing, and you send it to me as if I was the vet. We then sit down together, and I do a one-to-one for every single one of these, and we go through it all, and I teach you a little bit more, and then we go on to the next one, and the next one, and the next one, and hopefully at the end of 5 case studies, you qualify, you graduate. Yay! Now, once you graduate, certification lasts you for 3 years, but it doesn't just finish there. We actually induct you into the Association of Dynamic Dog Practitioners. You actually get a year free within there. And once you're qualified, you are actually expected to stay within the association, so we can continue to maintain high standards. Every year you're actually asked to submit a couple of case studies or a couple of reports that you've done previously throughout the year, to see if you're still using Dynamic Dog correctly, and if there's any areas that we feel that you need further support on, and then we help you with that. Because we all want everybody singing off the same hymn sheet, and we all want you to be the best you can be and go out there and support as many dogs as you possibly can. But in the association, you get more support, peer-led support, more support with me if you want to. There's a ton of CPD in there, so we get speakers in. We've had the likes of Chirag Patel, Conor Brady, Kim Brophy. I go in there quite a bit as well. As part of being in the association, you get continued access to the course material and any updates that I make to it, so you don't just get it taken away from you. And when I update it, you get more stuff. You get listing on the Finder practitioner page of the website. And we also have a qualified mental health advisor in there. She is qualified with a master's in psychology. She's not there to therapize you, but she is there to listen to you confidentially and point you in the right direction of some help for you. Should you feel overwhelmed with anything to do with life, you've got someone there. And then after 3 years, we actually ask you to take a refresher. That refresher, basically, once you've gone through 2 months of skills and knowledge update, that means that you retain your practitioner status for a further 3 years, and you are able to stay in the association. So I've waffled on enough tonight, so I thought you guys would like to meet my team and some of the graduates, and maybe ask some questions. So first of all, I'm going to introduce you to my right-hand lady, and all-round good egg and phenomenal support, Kerry Fosco. Kerry, do you want to say hi?
Hello. Yeah, hi everybody. I mean, a lot's been covered, that's for sure. But I think for me, as a student coordinator and mentor, I think it's really important to say that really when you actually do this dynamic dog course, you're not just learning alone, but you're stepping into a massive community where learning is a supportive and safe environment and a safe space, which, I think as a profession is at the moment, a safe space is just a wonderful place to be, isn't it? It is very intensive. I have done it twice. So I'm a bit strange like that.
You've been sat there next to me for a couple of years now, listening to me constantly.
Yeah.
He knows the course better than me, this one.
No, I don't. But yeah, it is very, very intensive. And I, as an older lady, I'm not that old, but found myself sort of sucking my thumb on numerous occasions in the corner, rocking and looking quite odd.
Mm.
Well, I am quite old, but anyway, but yeah, it is intensive, and I do think that has to be stressed because sometimes it can be a little bit of a shock. But most of us, as behaviourists and trainers, have done courses anyway, so we know kind of what we've got to do, and it's more about time and so forth, and fitting it in around your job because we all have to get paid. So that's very important. But I kind of want to give you, I want you to imagine something. So and I think this is really important about this course. I'm very passionate about it. Um, but you think about how hard we work to address these behavioural issues. But then we say to ourselves, before we become a dynamic dog practitioner, we say to ourselves, something doesn't quite add up. How many times have we said, well, there's something not adding up. What is it? And the usual techniques that we use aren't working, and we kind of sense that more is happening underneath that dog or underneath the surface of that dog, because that's what the dynamic dog course is about. We're looking underneath the layers and layers and layers, not just what we see. It's what we don't see. And that's where dynamic dog comes in. So the missing piece of the puzzle, I do like that metaphor, the missing piece of the puzzle that helps you see the whole picture. Promise you, and you can pick me up on this if you say that, Carrie. But by the time you complete the course, you'll not only have unlocked that missing piece for your clients, but you'll also have transformed the way you approach every consultation. I promise. This isn't just knowledge. It's a new way of working with dogs that sets you apart from others. I promise you that. And that's kind of where I kind of come in. But that's me, and yeah, you'll see me a lot, and you'll hear me a lot because I talk far too much.
She
Thank
doesn't.
you.
She also does one of the presentations in the course as well, and she's very good at it. Very, very good at it. We also got Gemma. Gemma, do you want to come in and just say hi as well? Do you want to? There you
There we
go.
go, I've unmuted. So hello. Yeah, Kara's basically said it. This will totally change how you look at dogs and how you look at behavior. And it is an absolute game changer. I know I said a lot, but it's completely true. You will not look at dogs the same ever again, which can be seen as a blessing, or you're driving along down the street and you see a dog and you're like, oh. Um, so yeah, it completely changes how you work with dogs. It completely changes how you think about behavior. And like Kerry said, before becoming a practitioner, there were those cases where you'd get really frustrated because you would hit brick walls, and they would have had a health check from the vet and everything's fine. But you were questioning, there's something I'm missing. There's got to be something because this doesn't add up, or there's got to be something. But then you're just left because what else do you have? And what this does is it really gives you the tools and the what's the word I'm looking for? Help me out, Kerry or Gemma. The tools and the ammunition, is that the right
Yeah,
word?
that's fine.
To put things
Mm.
together to not only kind of help the owner understand and support them,
Mm.
but also they can then go back to the vet, instead of just walking in and saying, I think my dog's in discomfort because we're not making progress with behavioural training. They've got substantial evidence with a very professional report that goes with it, which is, very well done and is unlike anything else. And they have that, and that's what then gets them to the next bit. So it's a complete game changer. There's no other way to describe it, is it? The missing piece of the puzzle, complete game changer, and it's needed. You need it in your practice.
Yeah, that's exciting.
Thank you. It's Joe. Joe disappeared now, I
She
think.
Yeah,
had to
she had
go.
to look after him. Yeah,
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 my other
family.
mentor had to go. So, but she's amazing as well. Alistair, step forth, Mr. Technical Boffin.
I
Hey,
love
to
it.
see
I
you.
love it when you describe me as that. And I wanted to say to everybody now that my knowledge of the tech stuff is
far away from
comparative.
Phenomenal.
no, no,
It's
it's phenomenal.
comparative. It's not
No,
absolute. It's just
no,
more than everybody else.
exactly, which makes him a technical boffin in everybody else's eyes.
And useless.
So yeah, I I think the words people were looking for earlier, completely agree. For me, it was paradigm shifting in how I work with dogs. It completely changed
I know.
everything. And I think particularly if you do any work with any kind of behavioural issues, so problematic behaviours of any kind, it's vitally important because that 8 in 10 for me, personal experience, I think underplays it slightly. I'd say it's almost all of my behaviour clients have pain as an underlying issue. And yeah, it's been a fantastic addition that's completely changed how I work. In terms of the tech stuff, so I completed the course in November of 22, and then somehow Gemma voluntold to get me to help redo some of the tech module, or redo the tech module completely. So it's really just taking things through so that you have the requisite tools and knowledge. To be able to put things together, as Gemma said earlier, in a professional way that looks clean and is concise and puts the information in front of the vet in a way that looks professional and easy to understand. You know, that's the main thing. We want to make these things as quickly to kind of compute as possible. So we want the vet to see what it is that we're talking about with very little effort, and we want it to just kind of work. And I know that I think the difficult thing for me putting the technology together was that we're dealing with people who have kind of vast, extensive experience of doing editing and stuff themselves, if they've put their own courses, done hubs and things together, all the way to people who don't know how to open a folder on a computer. So we've got quite a vast range, and I'm hoping from past experience, anybody that's done it will be able to say that regardless of where you are between either of those two extremes, we've got everything there to kind of help get you through. So if any part of you is unsure or wary because of your tech knowledge, then don't let that hold you back. You know, that's of everything you're going to learn. That's probably some of the well, I don't want to curse it, but that's probably some of the easier and more
Mhm.
straightforward stuff to learn. So we've got all the stuff there, from the basics things all the way up to if you want to using tips and tricks and other bits and pieces and bits of hardware and stuff to make life editing a little bit easier. But hopefully we have it all covered.
Yay. Alistair's brilliant. He's very calm. He's a very
Yes.
calm person, so that even when you're kind of frustrated, he's like Mr. Zen. He's amazing. He's absolutely amazing. I've got a couple of graduates and I've even got a student here tonight. I mean, good here. But I thought you guys might like to kind of hear their experience of the course, not just from my team. Lisa Childs, I've known Lisa for actually, I don't know how long now. I don't want to say donkey's years.
Too long.
Too long. Lisa was on a cohort last year. Lisa, how did you find the course? Give us the good, the bad, and the ugly. I don't mind.
I
Just
think
be honest.
a lot's already been said. I mean, yeah, the course is intense, but it is absolutely incredible the amount of stuff that you learn. You actually kind of don't know that you can shove that much information in your head and retain it. The great thing is as well is the support is amazing, and it's fantastic the way the course is like broken down into little bits. So it's not like massive, great big chunks of information. It's like small sections that you can do a couple of those, and then go and have a break, then come back to it. It's really motivating because you finish a section, you're like, I want to do the next section. The course is amazing. It is intense. You do need to set aside the time to do it, but it really, I mean, I just loved it. I just absolutely loved it. And it has, as everyone else has said, I work as a clinical animal behaviourist, and it has been game changing in the way that you work. It's so fantastic to have that knowledge that you can then be able to look at a dog and identify these things, and then share that knowledge with the owner, and then empower the owner to help the dog, because that's what we're all here for at the end of the day, is for the dog, and having collaborations. I work with physios. I've actually had vets that have come back to me. I've just had a vet come back to me to book a consult for her own dog because she was so impressed with the dynamic dog report for a mutual client that
well
we were
done.
working with together, so it has just been game changing. And there's so many cases I've done where dogs have been on pain trials and behavior has vastly reduced, where dogs have been diagnosed with, like, one 2-year-old cocker diagnosed with bilateral hip dysplasia, another that was a 6-year-old cocker. Another 2-year-old cocker diagnosed with luxating patella and had surgery, and it's game changing to the behaviour that the clients are seeing. So yeah, I was so proud to graduate. I'm really glad to be here. It was lovely to be asked to share a bit of experience, and yeah, it's just fab.
Thank you, Lisa. Thank you. That's really good that you've got a
Too.
vet has asked you to do a dynamic dog.
Yeah, I think my jaw did drop and I had to go and make another cup of tea when I read the email. I was like, did I just read that?
Yeah. We've actually got a vet on that's actually doing the course right now, Michaela. But also we actually have 2 vets that have contributed to this course as well. The brilliant Vince McNally, Vince the vet, has done a bit on food and behaviour, and also a veterinary acupuncturist has also done a bit on how acupuncture can help with pain and things like that. She's actually described it and used my late great Rombon as a bit of a case example. So that's there. But thank you, Lisa. Thank you very much. Also, recent graduates, literally fresh out the box, all shiny and new. We've got Angela Doyle, who is going to share. I mean, Lisa did the course when it was still 4 months. It's now a 6-month course. So Angela has literally just finished it as a 6-month course. The last cohort. Angela, share.
Hello. Hi. Yeah, I mean, without wanting to sound like a broken record, yeah, it has absolutely already changed everything. It is intense, as everybody has said, but I don't think intense is bad. It's really motivating. You do have to manage your time, which is not a bad thing. I really like the way you can't just, because I do have, let's face it, Gemma, I do have a bit of a tendency to want to kind of get things done as quickly as possible.
Very enthusiastic.
Let's go with enthusiastic, yes. But you have to complete one section, then you have all your feedback for each assignment before the next set gets released, which is really helpful, because otherwise, yeah, it would be tempting to rush on. It has changed things already. I specialize in separation anxiety, so a lot of my work is remote. And I have lost track in the past of the number of times I've referred clients' dogs back to the vet. Always get veterinary referral, but that doesn't really, necessarily mean a lot. In the past, I've referred them back to the vet, but all my kind of terminology obviously has been really vague. I have just said, like Gemma mentioned earlier, can you check the dog over for pain? And obviously that gets nowhere. Vets don't ever get back to me. Recently, even just recently, I've referred 3 of my clients' dogs back to the vet with like proper, not a full report because I was already working with them, but a proper terminology, and I've been able to explain confidently what I can see. All of those dogs are on pain trials. One of them is starting to do considerably better already, and the other one, they have kind of diagnosed something already. So it's made such a difference to be able to confidently assess the dogs and kind of speak to the owners about what I'm seeing and why that could be causing problems in our separation anxiety work, and then confidently liaise with the vets. And I have found that vets are actually replying back to me and engaging in a conversation, which they haven't done before. So yeah, I think it's the best course I've done for many, many reasons. And like Alistair said, actually, with the tech side, if you're worried about the tech, I really wouldn't be. I had done video editing to an extent, as in cropping my videos on a phone. That is it. It's really easy to pick up, and that shouldn't be something to put you off doing it, for sure.
Amazing.
So, in a nutshell.
In a nutshell. Thank you, Angela. Thanks for coming along.
Thanks for asking me.
No, thank you very much. Debbie, I know I didn't ask you, but as a graduate of a year or so, did you want to jump on and speak, or you can say no if you don't want to? Debbie's gone. Debbie's just silent. Debbie's just rocking in a corner, I think. No? Okay, don't worry. That's fine. That's absolutely fine. So I'm going to jump in and answer some of the questions.
Yeah. Sorry.
Let me have a look.
My chat box is gone.
Was it possible? What possible relation exists between Peanut's diagnosis and his reluctance to go to potty at night? I've seen similar behaviour in a few dogs where pain is suspected. It can be. So that is really, really interesting. I see it in cases where so we're changing from summer into autumn, and a lot of dogs with noise sensitivity surrounding maybe thunder and fireworks. I see literally as the seasons change, I see dogs withdrawing into themselves, not wanting to go out at night and things like that. I think Gemma O'Leary, before she left, actually answered that question and said, in actual fact, sometimes because it's cooler and colder makes a dog more tense because they're kind of trying to keep warm, and that can exacerbate more discomfort from a dog that's already feeling physically uncomfortable. So that could be, but at the end of the day, we just don't know. We're not them. We can surmise, I suppose, but you know, at the end of the day, just get the dog checked out, ask for a pain relief trial, and see what that transpires. You know, does that improve? Okay. So a connection between the dog and his footing and impact on pain. Could be. Right. Metrocam is widely used. Sadly, this is not one we have been able to use with our flat coats. Intestinal bleeding within 48 hours. Yeah, could be a brief related thing. However, we had no issues with other breeds we live with. Okay, cool. Debbie saying she works closely with vet physio. I've had a behavioural clinic. Yeah. I just want to make sure I'm not missing anybody's questions at all.
Julie's got a question, Gemma. Julie's got a question about she'd love to do the course, but what if she doesn't get 5 case studies to work on?
Oh, that's a good one.
Oh, yeah, it's a good one.
So what we can do is that obviously for your second module, everybody is going to be working with a dog and gathering photos and videos, yeah, as part of your assignments. So guess what? When you get to the end, if you don't have enough case studies, we just say, can you swap dogs? So your module 2 dogs, we go, you give the other person all the raw material, and then you get to assess them, and they, you know, if they can give you a 90-minute consultation, great. Yeah. We have a small handful of dogs that we can supply you with. But yeah, I mean, at the end of the day, you can use friends' dogs, families' dogs, past clients that pop into your head thinking, oh my God, this has just kind of, you know, answered a lot of questions for me. Let's get this dog assessed. New dogs coming into your business. You know, you've got quite a lot of scope there. Usually one Facebook post saying that you're doing a course and you need case studies, you will be flooded with potential case studies. So don't worry. Normally, kind of like at the end of module 2, we start putting the feelers out and things like that. Okay, so we've got Susan said, I am a CPDT KA with many years of experience of working for a veterinarian. My struggle is not in identifying pain, but in convincing the vet and frequently the veterinarian that pain actually is behind the behaviour. It's a struggle to convince pet parents to even consider a pain trial. How do you bridge that vast gap when no one is listening? With regards to pet parents, guardians, owners, however they want to call themselves, it's really about education and what you put out into the world. Okay, so you need to start talking about this more. You need to start talking about the factors that affect behavior. You need to put that on social media. You need to put that onto your website. Start talking about it. If you have a free initial 15-minute call with people, you need to talk to them about it, you know, and you need to say, I'm sorry, but potentially there could be an underlying condition with your dog. Okay, the first vet that you spoke to might have said there's nothing wrong with him, but you know, if we took him to another vet, that might be different. You know, we could get a second opinion, or we could get him assessed. away from a vet and see what we get. I just now get a torrent of people come to seek me out because of what I can do. A lot of my graduates are the same, and where I'm inundated, I will actually give my graduates my any kind of inquiries that I get and things like that. So it's really down to kind of education and what you put out there, so that if it's in your emails, if it's on your website, if it's, you're talking about it on social media, when they seek you out, it shouldn't be such a shock to them when you mention it and when you talk about it. And the more you talk about this stuff, the more it's going to get out there. And it's just down to education at the end of the day. Part of what we give the graduates when they graduate is a bonus marketing module, and in there is a bit of a presentation that they could copy where they can take it into vets and actually start talking about this as well. And that we get so many positive responses from vets with regards to those presentations, that they then start referring people to our graduates as well, which is amazing. So that's how we start to kind of like bridge the gap. It's slowly and surely kind of just keep going, and eventually you get a foot in the door with practices, and vets start listening. Okay. Do you have to be or recommended to be a behaviorist or dog trainer? I'm certified professional pet sitter and dog walker and really want to help my clients with more than what I see. Do you think this is suitable for me? I'm learning sensory rooms right now and certify people in pet first aid. So we do ask that you have some form of understanding in training and behavior. Has to be positive as well. So you know, it kind of fits in with our ethos. The best thing to do would be to have a chat with either myself or Kerry, and we can talk things through with you and kind of what you've done so far, and find out your understanding of training and behavior, and then go from there. We do have non-trainer and behaviorist practitioners, but obviously we've sat down at length and discussed with them what they know and things like that before we've let them on, and we have had them graduates. Tessa Saville-Cole of Puzzle Dog, she's not a trainer and behaviorist, but she works exclusively with Hersenwerk and Nosework with dogs, and she is an amazing dynamic dog practitioner. So primarily, yes, trainer and behaviorist, but where you have a strong understanding of training and behavior, we'll talk to you and we'll find out what is what's what, and then whether it will be a good fit for you at all.
Tessa's actually the one that's training me in the sensory rooms right now.
Oh my God, you lucky person.
I know. We live very close to one another. So yeah, she's amazing. And I'm also working with Steffi Guy, who's also one of your dynamic dog practitioners.
Tessa is just, I could eat her with a spoon. I to be quite honest, watching her work with Puck, her dog, is like ASMR for me. If you guys know what automatic meridian sensory response, I flipping love her. Just watching her dog is just like, I sit there with a grin on my face and my cheeks hurt after like 10 minutes. She's lovely. She came to my 2-day workshop this year, and she came and stayed with me, and I couldn't have hugged her more. I love the bones of that woman. Just, you're a very, very lucky person, and everyone should experience Tessa. She's phenomenal, absolutely phenomenal. I love her. You're so lucky. Yeah.
Thank you.
Claire is one of our graduates, Claire Williams, the amazing Claire Williams. I found all of my case studies through various Facebook groups. I was on especially an aggression in dogs one, where you could see from videos there was potential issues, and the dogs, no one said no to a free assessment. There you go. How many practitioners do you have in the US? Some of them are listed on our Find a Practitioner page, and some of them are literally just graduating now. I think we have at least 5 on the current cohort who were just kind of just graduating. So we have them all over. We've got them in Australia, Germany, France, Ireland, God, where else? Spain. God, I've lost track. US. See if I can enroll someone. I go to Mexico next week. Yeah, just all over the world. I'm going to drop that one in, Alistair. Alistair hates the fact I'm going on holiday next week.
No one likes someone being smug.
So yeah, but any other questions at all, guys? Whilst you've got us here, you can speak to the graduates. You can.
There's one buried in the comments there from Annie about, I can't find it now. Do you ever get pushback from the clients, like now they have the info that they should act on and that they'd perhaps rather not know?
I don't know, basically because people seek me out for what I can do. So what we do say is with the case studies, sometimes people don't want to know. So if you've got people that have offered their dogs for case studies, that ignorance is bliss, and they don't want to know, and we give them the opt-out option. But generally, no. What we sometimes we do get, we've done the report, the report's gone to the vet, we've spoken to the owner about next steps, they've gone to the vet's turned around and said no, there's still nothing wrong with the dog, and the owner's happy to take that. And if they're happy to take that, then you can't help everybody, and that's what we have to understand. And whilst we want to help everybody, we can't, and some people aren't ready to hear the information yet, and that's okay. So you as the saying goes, you can lead a horse to water, but you can't make it drink. All you can do is give people the information and let them do what they want with it. But as long as you've done your job and the information has gone to the vet, that would have been noted in the vet records. And if anything comes up down in the future, you spotted it first and nothing's been done. You've done your job, and that's all you can do, basically. Okay. Any more? Anything else I've missed at all? Kerry, Alistair?
Don't think so.
Okay, and you got it, thanks. I do gait and posture for all of my body behavior mods regardless, and sometimes struggle to get that information across. Thank you. Annie, yeah, also what we see a lot of is you don't always see things in gait analysis. Quite often we start to see problems with activities of daily living and the ambulation and the functional assessment, which is aside from the gait analysis. So when the dog's actually just kind of doing stuff around the house, that's when we see the majority of the problems. So yeah, it's dynamic dog is kind of, we look at everything. So if you're interested in kind of bolting on more to your kind of gait analysis and posture stuff, then do kind of let us know. So good, get in touch, Annie, get in touch. We want to speak to you. Any more questions at all, guys? I mean, it's been nearly 2 hours. I'm really sorry. It's a Friday night. You must all be kind of, losing the will to live. So, right. Okay, if there's no more questions, we'll let you go, and we will see you again soon in the free group with some more information. All right, take care, everybody, and have a good Christmas, guys, and we'll see you soon. Take care.